sanitizer containers. This is the proper technique for removing gloves. This is to ensure that you don't get any pathogens on your skin. You can see how you're taking it off with the one glove, and let's see if it goes into the next. You're balling it up. Sorry. What you're going to do is you're going to take that remainder of that glove that's in the left hand and put it in the right hand. And then you're going to take 2 fingers from your left, slide it underneath your glove, and then slide that other glove off just like you did with the other one, if that makes much sense. Key points when talking about BSI and PPE: always put on disposable gloves before physical contact with every patient. Always change gloves before caring for another patient. Always change your gloves and wash your hands if gloves become soiled. Put on clean gloves. Always dispose of gloves properly, and always wash your hands after removing your gloves. Gowns. These are used in situations in which large splashes of blood or body fluids could occur. This includes childbirth, vomiting, massive bleeding. There's also some communicable diseases that you will want to consider utilizing gowns with. For example, C. diff, which causes an immense amount of diarrhea. This can be transmitted topically, so you want to be very careful about this. Surgical type face masks, used to protect against possible blood and other body fluid splatters, used in situations in which an airborne disease is suspected, and change the mask if it becomes moist. Some things you can consider with surgical masks is you can put one on yourself, and you can also put one on your patient to help reduce the risks. N95 HEPA masks, you often hear these referred to as TB masks. TB stands for tuberculosis. This is used if a patient has or may have an airborne disease such as tuberculosis. They encourage utilization of these for influenza and other various airborne pathogens. Go back to that. The reason it's called an N95 is it blocks out 95% of airborne pathogens. Immunizations. It is extremely important in the healthcare field to keep your immunizations up to date. Most reasonable employers of healthcare providers will be able to provide these vaccinations for you. Tetanus prevention. You should receive a booster every 10 years. Hepatitis B vaccinations. This is a 3-shot series. You get it once, then you get it a month later, and then you get it a year later. Influenza vaccine. I'm sure you've heard a lot about the flu shots. These are given annually. They can be given in various forms. This past year, we had the H1N1 vaccines, which were given intranasal. They were also given IM or intramuscular. And what they do is the year before they attempt to plan and they attempt to figure out what strand of flu will be most prevalent this year, and that's what they vaccinate for. And the thing with influenza is there are literally hundreds of different types of flu available in the world, and it's difficult to figure out what the appropriate vaccination is for that. MMR, the measles, mumps, and rubella vaccine. Most people receive that while they were going. It was required for school. Documenting and managing exposures. Excuse me. If you are exposed to blood or body fluids, immediately wash the affected area with soap and water. Notify a designated person as soon as possible. If this occurs during ride time or clinical time, you're to contact me immediately. I will put you in touch with our infection control officer. Every service is required to have an infection control officer who's responsible for ensuring the safety of providers. And what they do is they go and they run tests. They'll draw blood and things along those lines anytime an exposure occurs. And that's what this is. This one section, getting a medical evaluation, comes into play. they'll go and they'll get the proper medical evaluation and document as appropriate. They'll get you the proper immunizations if necessary. For example, if you come into exposure with rabies, they'll go and get you a rabies vaccination. Um, Unfortunately, if you come into contact with something such as HIV or potential HIV or AIDS, then what they'll do is they'll put you on prophylactic antiretrovirals, which will make you very weak, but it will ensure, well, I can't say ensure, but it will help prevent it'll decrease the likelihood of you catching HIV or AIDS. Documenting and managing your exposure. Ensure that you document the date and time of the exposure, circumstances surrounding the exposure, type, source, and amount of body fluid to which you were exposed, and actions you took to reduce the chances of infection. Make sure you thoroughly document these, keep a copy for yourself as well, and leave it with your employer. When you're going through cleaning your equipment, make sure you clean all your equipment thoroughly. Backboards, anytime you use a backboard, make sure you clean it. If the hospital doesn't clean it, whenever you transport a patient, you should go through, use whatever disinfectant your service provides. It may be Lysol, maybe germicide, whatever it is. Make sure you spray everything down appropriately, wipe it down to the standards set forth by your service. As far as sterilizing goes, there's not too much that we do in the field that we actually sterilize. Sterilizing generally has to be done with an autoclave. We do carry some sterile products such as an OB kit, but we don't actually sterilize the equipment in there. That's done before it ever gets on the ambulance. And this concludes our infection control lecture. Again, this was for Chapter 2.